guys, I get this question almost every day working with people on Medicare. What is the difference between original Medicare and Medicare Advantage? Okay, I'm going to do the most simplistic version that I possibly can to keep this video as short as possible. Starting with traditional Medicare. Original Medicare consists of really three parts. You have your original Medicare card, the card they send you, the red, white, and blue card that has your name, your identifier, and your Part A and B and the dates that they begin. That card is your primary insurance when you're on the traditional route of Medicare. They're paying basically 80% of your health care. You then need to choose a supplement or a Medigap policy through a private health insurance company to cover the remaining 20% that you're responsible for, giving you basically 100% medical coverage. With this route, you also have basically no network. You can go to any doctor, any facility, clinic, or hospital in all 50 states as long as they accept Medicare. If they accept Medicare, they have to take your supplement. That's the law. The last part of original Medicare is adding that prescription drug plan, Part D. Original Medicare, even with a supplement, covers no prescriptions at the pharmacy counter. So adding that Part D prescription drug plan is going to help reduce those drug costs at the pharmacy counter. So 3 cards, 3 premiums that you pay, a nationwide network, and basically 100% medical coverage in most cases. The other side, Medicare Advantage, also known as Part C. Simplistically, Medicare Advantage is privatizing your health insurance through a particular company. One company with one card, built very much like insurance you've probably had your entire life through an employer, things like an HMO or a PPO. It's what I call the pay-as-you-go, pay-as-you-use-it model, meaning you're going to pay copays as you utilize health services throughout the year. Copays are co-insurance, meaning you're sharing some of the cost of everything that you have done. The next difference, they do operate within networks, okay? So just because the hospital that you go to accepts original Medicare does not mean they accept every Medicare Advantage plan. That is a separate contract that they negotiate with that particular insurance carrier. So you want to make sure your doctor, your specialist, your hospital, your clinics, all that are within the network of the plan that you choose. The other thing is they oftentimes do offer extra benefits, things like dental, vision, hearing, gym memberships, and some flex spending accounts that original Medicare does not offer, okay? So Medicare Advantage, very simply, is Part C. It is privatizing your Medicare to a particular company. It's paying as you use it up to a certain dollar amount every year, known as the maximum out of pocket. You need to stay within their network, and overall, it's more of a managed healthcare plan by a private health insurance company, okay? So 2 very different models of how to access your Medicare, and depends greatly on you as an individual of what you prefer to do. So talk with someone who knows about the Medicare system and can advise you accordingly.